Welcome to the legislative update for the week ending Friday, April 2nd. My name is Colleen Patterson, and I'm the Director of Employer Services and Compliance at Savoy. This week, we're going to continue our discussion about the American Rescue Plan Act, which we all know is ARPA, ARPA. However, we're going to focus more on the individual market as ARPA has made some significant changes to this market as well. As we know, the Affordable Care Act has provided subsidized health insurance on healthcare.gov, but also on state-run marketplaces all the way back to 2014. The passage of the American Rescue Plan Act in March 2021 expanded marketplace premium subsidies. So joining me today is my colleague, Clare McCarthy, who is an account manager on the Consumer and Senior Markets team. Clare has helped countless brokers help individuals navigate through the complexities of the marketplace. So Clare, how have the premium subsidies been enhanced and when are the enhancements effective?
Well, Colleen, first of all, thank you for inviting me here today. Well, under the American Rescue Plan Act, beginning on April 1st, ACA premium subsidies are substantially enhanced for people at every income level for the 2021 and 2022 coverage years. So enrollees at lower income levels could even see their monthly premiums reduced to zero. So before April 1st, 2021, right, under the ACA, people with income above 400% of the federal poverty line were not eligible for any marketplace savings. Now, for the first time, people with income above 400% of the federal poverty line will be newly eligible for marketplace premium subsidies. So this means the individual who was making $51,000 or the household of four who is now making $104,000, they're going to be eligible for new premium savings. So this means, though, that they will be required to contribute no more than 8.5% of household income annually toward the benchmark plan, or also known as the second lowest cost silver level plan in their area. However, it is important to note that some consumers who are making more than 400% of the federal poverty line may not receive a tax credit if the cost of the benchmark plan is less than 8.5% of their household income. Another big change is that now the American Rescue Plan Act waives the requirement to repay additional subsidies when filing 2020 taxes for people who had income that exceeded the amount stated in their application. So that's a very big change this year.
So how does this affect individuals then who are currently receiving unemployment benefits?
While consumers who received or are receiving unemployment benefits in 2021 will be eligible for premium subsidies and cost share reductions as if their income is at 133% of the federal poverty line for 2021. This means they will be eligible for that zero premium benchmark plan that I had mentioned earlier after the premium subsidy is applied, and also they'll be eligible for reduced cost sharing. This, of course, will lower their overall out-of-pocket spending.
So there's a lot of changes going on that you're talking about. So do we have any specifics regarding a timeline for implementation of all these changes?
Yes, so starting April 1st, increased subsidies along with expanding subsidy availability to consumers with household incomes above the 400% federal poverty line are available through healthcare.gov. So this means that new customers or current enrollees who submit an application and select a plan on or after April 1st will receive the increased subsidy for the 2021 coverage year. Now, the New Jersey state-based exchange called Get Covered New Jersey and the Pennsylvania state-based exchange called Penny are working to implement the new change and will notify the consumer when they can expect to see their savings. We, of course, here at Savoy will continue to keep our broker community updated on any changes, so everyone needs to stay tuned.
So what changes then have been made to the marketplace subsidy eligibility, if any changes at all?
Subsidy eligibility is still based on the consumer's household size, the expected annual income for the coverage year, the number of household members seeking coverage, and of course, if that individual has access to affordable group plans.
So, Claire, I had recently discussed the temporary Cobra premium subsidies for 2021 and how ARPA provides for temporary Cobra premium subsidies for up to 6 months during 2021. As we know, subsidies will cover 100% of monthly cost of Cobra while people are eligible. So, could the people who are eligible for Cobra subsidies also be eligible for marketplace subsidies or even Medicaid?
Yes, so eligibility for the Cobra subsidies does not affect eligibility for a marketplace plan with a subsidy or Medicaid.
So, how come all of this is important for us to know?
Well, Medicaid also offers premium free coverage, and depending on the state, Medicaid charges a small monthly premium for some adults with no or very little cost sharing. As individuals consider their options, they will need to compare provided networks, cost sharing, covered benefits, and of course, other plan features.
So, what happens when Cobra premium subsidies end? If they can't continue unsubsidized enrollment in Cobra, can they go back to the marketplace?
Well, as of March 31st, healthcare.gov and Penny have not released any information regarding the possibility of a special election period for this situation. However, Get Covered New Jersey has announced that open enrollment has been extended until the end of the year. So actually, Colleen, this is a good time to go over the deadline dates for open enrollment. So New York and New Jersey announced last week that open enrollment for individual health plans has been extended all the way through the end of the year. Open enrollment in Pennsylvania remains through August 15th, and states using healthcare.gov, like Delaware, also have a deadline date of August 15th.
Thank you so much, Claire, for all of the information. One thing's for sure is that there are a lot of people that could benefit from all of the info you gave us today. So thank you so much again for all of your insight. This concludes our updates for this week. As always, should you have any questions, please reach out to your dedicated Savoy team and continue to use the resources that are available on our website at savoyassociates.com. From all of us at Savoy, stay healthy and safe. Thank you for joining us today.